been a while since I have actually vlogged. I figured I would try to vlog today. If I sound a little weird, it's because my mouth is numb. Because I went to the dentist today to do a crown on my tooth. And just note, worldly advice, make sure you take care of your teeth. Because it's costing $700, which is a lot. I need to run by the bank and do things from the bank, and then I'll be on my way home. I need to access today and do fluids. I've been kind of in an orthostatic hypotension flare this week. I think it's because since it's the holiday season, I've been really busy with work. So that might be the reason why. I'm not quite sure. So I need to go by the bank. I also need to do some housework, access, do fluids, and hopefully finish figuring out my budget. And I might train the dogs today, I'm not quite sure. But I'll take you along this journey. So I've decided to stop by Kroger to get some food because I am really hungry. This is actually what I got at Kroger for my lunch. Yes, I know corn fritters are not gastroparesis friendly, but I've been craving them really bad for the last like 2 months, and I've had a hard time finding them. And with me having a past of an eating disorder, it is very smart sometimes to just give in to those cravings. That way I'm not going to binge on them when I do eat them. And yes, I know the consequences of eating the corn fritters, but I'll pre-medicate with Zofran, and that way I can enjoy the food I like without being overtly in pain or super nauseated. I also got some sour cream to dip it with, but I also get the light because it's less fat, which means it's less going to bother my stomach. Anytime that I'm having food that I know is going to upset my stomach, I pre-medicate a lot of times, because as someone that comes from the past of an eating disorder, I need to make sure I take care of my mental satisfaction of food as well as my physical. So yes, the corn fritters are not a smart idea to eat on a regular basis for gastroparesis, but it's what will like satisfy me mentally. And I know the consequences of eating them, and I will deal with the consequences when they're happening. Also, I'm not in a flare right now of my gastroparesis. I'm actually dealing really well right now with it. So I feel like I can splurge on eating the corn fritters. So I'm going to fix these, and then I think I'm going to take a bath. So I'm about to take a bath, but I wanted to show you some of the products that I use when I'm taking a bath. So I have some Epsom salt. I use this because it helps like with muscles and that kind of stuff, because I do get muscle pain. And then I have a bath bomb just for like the scent, and I just love bath bombs. And then I got this at my work. It's 100% coconut oil sugar cubes, and it just smells really good, and it kind of makes my skin actually soft after taking a bath with it. And I always have some kind of drink when I'm taking a bath. That way it's easier for me to get out of the tub easier. I don't feel like washing my hair right now, so I just put my hair up in a ponytail or a messy bun, and then I run hot water. I usually turn off the lights because I actually like taking a more darker bath so I can relax. I also light a candle. I'll probably stay in the tub about 20-30 minutes. That way I can relax and that kind of stuff. I usually throw on a YouTube video and watch that as I take a bath. That way I'm like trying to relax and that kind of stuff while I'm taking a bath. And then I will get out of the tub and I will usually come and lay down. I use my parents' bathroom because it's a bigger tub. So I usually come and like lay on my parents' bed. That way, because theirs is a Tempur-Pedic bed. So it like rises and you can raise it up and that kind of stuff. So that's why I usually use their bed to like lay down for like 10-15 minutes, and then after that I usually get on with whatever I'm going to do for the day. So that is what I am about to do. So after taking a bath, I'm actually feeling quite tired and relaxed. So I have decided I am going to take a little bitty nap, or at least like relax my eyes, because trying to hold them open is really difficult at the moment. And then I think I'm going maybe go take the dogs on a walk. And be like a 10-15 minute walk to get some of my steps in because I haven't been very active today. So hopefully I can take them on a walk. It probably won't be that long. We're out on our walk. I had to sit down on a rock at my uncle's house, but they're sitting down and being good munchkins. And then here's Bella. She's not sitting, but that's okay. Diva! She's like, I'll go say hi. Right now we are working on plays. You can't really see Bella over there, but she's over there. I have them tied to their little cots with a bone. So that's what's happening now. That way they have a place of their own that's in the living space. So if someone does come over, their people are not barged by dogs. So for the rest of the night, I have just been like planning. I'm trying to start being more consistent in the dog, like training the dogs. That way, when or if I do decide to start training a service dog, I'm consistent. I'm at that level that I need to be to stay consistent to train the service dog. I'm not quite sure if I will be getting a service dog. I still haven't made up my mind yet. I've discussed it with my doctors. Both my rheumatologist and cardiologist are okay with me getting a service dog and seem to think it could help. But I'm just not sure if I'm up to training it myself, and I know I cannot afford one outright from a program. So I'm still on the fence. I've been looking into service dogs for years now. Ever since I first started noticing my issues. I wasn't like, oh, I want a service dog. But like, as the years gone by, I can see how it could help me with counterbalance, with other things like possibly medical alert. Also, I actually have trained Diva to do deep pressure therapy already. So, like, I know that one helps, especially when I'm having a really bad anxiety attack or if I'm feeling extremely lightheaded. So, I've been like planning out what kind of training I'm doing with the dogs next week. Basically, I'm going to start right from basics. I mean, they pretty much know it, except Penny. But I want to solidify and make sure they have it pretty well down pat before moving on to tricks and that kind of stuff. That way, they're more well behaved. So I've been planning that, and besides that, I haven't really done much else today. What else? There was something else. This is brain fog is real, people. I'm trying to think. My brain is not working. Basically, all I've had to eat today was corn nuggets. I just snacked on them all day. So, not the best eating wise, but that's okay, because I kind of knew that I was going to have a problem with the corn nuggets. I'm not like super nauseated, because like I've been just snacking on them all day. And I did take a Zofran before I ate some of them. So, like I said earlier, I'm not having a super bad problem with my gastroparesis right now. So I'm kind of not really in a flare. So I'm happy about that. But you never know when a flare will happen. I do have nutritional shakes on hand if I need them. So, because I come to learn that I actually do need to pay attention to what I eat, because it plays a really good part on my symptoms. So, but today has not been that bad. With that being said, I'm actually about to get ready for bed. So I will see you tomorrow.